I'll be focusing on World Pharmacy Day that was marked on the 25th of September 2025, with the theme this year being Think Health Pharmacist. And of course, joining us this morning is none other than the President of the Pharmaceutical Society of Kenya, Dr. Wairimu Mbogo. Dr. you're welcome, and thank you for joining us.
Thank you.
And maybe we start on that note, given that we are now in the 30th of September. So in terms of the day as Kenyans, did we mark it as pharmacists? And as well as what are some of the issues were you able to note on that particular day?
So thank you so much for this forum. So my name, as you have heard, is Wairimu Mbogo, the first female president of the Pharmaceutical Society of Kenya in 60 years. And the conversation that we were leading on that day was Think Health, Think Pharmacist. And one of the things that we have noted in terms of healthcare in Kenya and globally is that the pharmacist is the most accessible healthcare provider and the most underutilized healthcare provider in the healthcare chain. So on that day, we were now discussing with patients, doing a lot of activities. If you follow our pages at the Pharmaceutical Society of Kenya, you will notice that all over the country, there were activities that were marking that day on the 25th of September, educating patients, community engagements, and just making sure that the public is safe when it comes to medication use. Yes.
And when you say underutilized, because we know the critical role that pharmacists play across the country.
Yes.
Because you see, when the doctor writes you a prescription, you'll be the first person I'll go to. So in terms of saying underutilized, what do you mean by that?
So in Kenya, we have two cadres in the pharmacy profession. So we have the pharmacist, who is a bachelor degrees holder in pharmacy. So they train for 5 years, do an internship, and then now they're the doctories. So I'm a pharmacist by that nature. And then there's the diploma holder, who is a diploma holder in pharmacy, just like we have a diploma holder in engineering and all other courses. So they do 3 years and an attachment training, and then they get an enrollment certificate. So within that aspect, we have not really identified what we call the scope of practice of both cadres. So what you find as the most available person in a pharmacy, as you have explained, is usually a pharmaceutical technologist who is a diploma holder. But we are working to make sure that the pharmacist is more available to the public, and we can discuss more as to why, how, and how we are making sure that that happens.
You can tell us how. And
yes, but just as a nutshell, we now have Pharmaceutical Society of Kenya is the umbrella body of 5,000 pharmacists. So we are over 5,400 pharmacists in Kenya. And unfortunately, about 2,000 of those are jobless. And what we are saying is that in this country, we are having a deployment issue where we are not having as many pharmacists absorbed into the healthcare system in the counties and in areas where they should be working in order to make sure that their services are available to the public. Nevertheless, we have the pharmacists who are in the major hospitals. We have pharmacists across all the chains across the country, and they're offering their services, whether it is at, supply chain level, whether it is at the patient-facing level, or in the back end when it comes to now the distribution, manufacture of medicines. Yes, and we don't have enough pharmacists working as yet. We have not reached the ratios that WHO recommends for pharmacists in Kenya. Yes.
So what's the ratio that WHO has recommended?
So the WHO ratio is that for every 10,000 Kenyans, there should be one pharmacist. Yes.
So
if we are calculating our population at 50 million, I believe that we should be at a number of about 100,000 pharmacists in Kenya, but we are training at around 5,000, which means we should have everyone absorbed into our system to make sure that the care of the patient is built on what the Constitution demands, which Section 43(1)A is our vision and our anchoring as the Pharmaceutical Society, that every Kenyan has the right to the highest attainable standard of healthcare. So for pharmaceutical care, we are saying that the Pharmaceutical Society of Kenya is the home of all these experts who can assure Kenyans of the highest attainable standard of care, and also in line now with the government objectives of achieving the universal healthcare coverage aspect. The PSK, or the Pharmaceutical Society of Kenya, is aligned to that goal and ensuring that the public has access to that highest standard. Yes.
And of course, given that you clearly stated that the ratio does not match what WHO has recommended,
yes,
what are the implications of that in our country, especially for our health system?
Yes. So some of the implications are grave because sadly most errors or most problems when it comes to medications are realized down the line. So for example, if we are not rationalizing medication from a patient perspective of a patient who, especially who is on chronic care, we get to realize that later they develop complications that are not good. So we are getting them to, you know, to kidney failure earlier than we should. We are having patients who are on too many medications, and also what we are working on with the Pharmaceutical Society is a mechanism as to how to minimize this medication and rationalization aspects so that the quality of life of this patient is improved. So how we are doing that is that, number one, we are working in a multidisciplinary team aspect. So if you go to most hospitals now, despite the few numbers, you'll find that in the wards that they are working with, you'll find that the doctor will work with a pharmacist and they'll work with other healthcare providers to make sure that the rationalization of the treatment of this patient is actually done in a better way. So when it comes to now the actual prescription handling, you're finding that there's a lot of collaboration between the pharmacist and the healthcare provider and the patient as well to understand what is the doctor trying to achieve, what is the patient trying to achieve, and how do we achieve this in the fastest, safest, and most effective way. So there's a lot of thinking that goes behind the scenes in terms of making sure that when we receive a prescription, that we are able to rationalize all that. And that's why even at the retail setting, most of the times when they visit a pharmacy with a pharmacist, if they receive a prescription, there are more questions asked. If they go for a diagnosis, you'll find that there are more questions asked because pharmacists are more than, you know, taking a prescription and reading it. We actually, the first 2 years, we trained together with our colleagues, the medical doctors and the dentists. So then we go into now more details when it comes to the medicine, and they go into, you know, surgical and other areas. But the basis is that we have the ability to make, you know, some diagnosis and also refer where we feel that a patient needs now further treatment. Yes.
And of course, you have just mentioned one of the issues that I wanted to ask in terms of us consuming so many antibiotics, because you see, when you have headache, we'll go for antibiotics. Whenever you have any general pain within your body, you're going for antibiotics. What are the adverse effects of such things?
So the first thing I'm telling Kenyans today, please listen to your healthcare providers. Let's not self-prescribe, especially when it comes to antibiotics, when it comes to medicines that cause other long-term effects. Antimicrobial resistance is actually a global problem right now. And we are working very hard with other bodies and also with other healthcare providers to make sure that, number one, there's a knowledge capacity, so that in terms of educating our patients and our people, that there is an aspect of we are making them aware that they should not use antibiotics without the rational aspects of it. I hope the English is a bit, it's not too heavy. It's not too heavy. Then that we are within the policy space, making sure that we are engaging with policy makers to make sure that the rules behind the use of certain medications is actually regulated. We have to be innovative in our approaches. We are now encouraging our people on the ground to make sure that patients are finishing their doses. So have an innovative way of making sure that we are recording how much we are giving away, and also that we are monitoring to make sure that that people are able to finish their doses of antibiotics when they need them, and also collaborating with the various players in the field to make sure that this problem is actually resolved. Because the sad thing that people don't understand, when we don't use antibiotics well, when we really need them, they don't work. When we really need them, like in the ICU or in other critical areas, they just refuse to work. So that now causes other effects, and we want to prevent that from happening. So that's why AMR becomes a very huge aspect in terms of making sure that the public remains safe with regards to antimicrobial or antibiotic use. Yes.
And do you feel as pharmacists that you play a critical role within the public health service?
Yes, we do. And even we reject a lot of prescriptions with antibiotics. So when we reject, don't go demanding for another one, because sometimes your symptoms or whatever you're suffering from, your body can self-manage. And as we manage the symptoms. So sometimes it's good to give time. If it's not necessary, it's good to give time for your body to deal with whatever is happening. And then we make sure that now at the end of the day that we're saving you from irrational antimicrobial use. In addition to that, we are doing a lot of education in terms of the public. Like now, this is now the education component where we are telling the public, question a little bit more on the use of antibiotics, and also finish your dose when it's prescribed to you. Yes.
Is there a difference between original and generic medicines?
I would say the difference is in the, number one, when it came out or who developed it, and then the generic medicine now comes in later. But when registering, there's something that is called bioequivalence. So bioequivalence is where we check that this original and the generic are working the same. So there are tests that countries do before you actually release that medicine to prove that this medicine is safe, it's working in the same manner, and it can be used for a certain condition to make sure that it's working. So generics are usable and they are more affordable than usually than the originals. But because many organizations or many companies are focused on the access component of making sure, especially for our region, for our markets in Africa, that medicines are more accessible now to patients, the price is now coming down to meet the, would say, quote unquote, the affordability of the population and not necessarily the affordability of the other medicine. Yes.
And of course, in terms of these particular drugs, do we invent them as well here in the country? And if not, if yes, tell us about it. If not, what can be done to take
boost
us there?
So one of the things that is very critical is that every region has its niche. So in Kenya, we mainly manufacture. We have actually a very vibrant local manufacturing sector, a very underutilized local manufacturing sector. And I would say underutilized because we should be manufacturing at 100% of our capacity, but I believe we're using only about 60%. And there are challenges around, the trade, economic aspects that hinder the manufacturing, but we mainly do generic manufacturing here. But in the process of drug development, even globally, we have a lot of Kenyan pharmacists and Kenyan scientists working in those organizations that are known to develop innovator products. So traditionally, this has mainly been happening in Europe and the US. And now we are seeing Asia and countries like Korea coming up with innovative therapies. And also Africa now, we are actually now thinking about, vaccines in malaria and other areas that are quite innovative. So I would say we are not 100% there, but we are getting there. We have the brains to get us there. All we need is the support from an innovative perspective in terms of investments to make sure that, research investment, to make sure that our people have areas where they can do the drug development aspects. And now utilizing also AI. AI is now a big thing in drug development, drug discovery, because AI has a lot to do with, how does this medicine work with this particular system, and how do you test it in terms of that. So we are now looking at areas of how do we incorporate AI in our studies to make sure that we are getting close to what the body needs in terms of the medicine, in terms of correcting the issues that the medicines are having. I'm sorry, that's a bit more complex,
no, it's okay.
But you can go back to that.
It's okay, because
yes.
The reason why I asked you that question, we witnessed what happened during the COVID-19 era.
Yes.
We're witnessing these superpower countries, we were asking for vaccinations. Some got pissed because we had to make our own vaccination. So in terms of getting there, are we close?
So currently what I can say is that we are engaging different ministries from a manufacturing perspective. Number one, I know there has been engagements with the Ministry of Trade to make local manufacturing, number one, more accessible or more vibrant from a funding perspective, and also from a trade perspective in terms of the probably subsidies or financing that would be used to manufacture so that our medicines are more competitive. I would be honest and say we are at 30%. 30% manufacturing, 70% imports. And we need now to move into sustainability, especially what we call our essential medicines list. We need to now move to a sustainability aspect where we are saying that let's move and see whether we can go reverse the order, where we're doing 70% manufacturing and 30% imports of our essential medicines. It's a journey. We'll get there, but we're not yet there. But the goal is sustainability, just like you have said, so that now we are not also liable to shocks. We call them global shocks. That's currencies, shortages, and many other aspects that would impact the security of our public and the medicines. Yes.
And given that earlier on you were talking about AI and how it has been significant, especially in this particular sector. So in terms of using technology within this particular sector, how has it changed the way you work as pharmacists?
So of course, now we have now more tools. I would say there are more tools to do comparisons. So for example, when a patient is on a lot of medication, so you can, before you had to use your memory to sort of figure it out, but now we are having tools that support, you know, the risks, that help you understand the risks around a particular prescription. As a Pharmaceutical Society of Kenya, we are collaborating. So at the Pharmaceutical Society, we talk about EPIC. So EPIC has to do with who we believe we are, because we believe we are EPIC as pharmacists. Then number two, we are focusing on 4 pillars: education, policy, innovation, and collaboration. And we are working with partnerships with people who are in the technology space, the AI space, to even bridge the gap when it comes to the knowledge in terms of utilization of AI. So we have started the conversation on making sure that our pharmacists understand how to utilize AI and how to use it in decision-making processes, not just the way it is generically used, like your chat GPT or what am I going to eat tomorrow, you know, not in that way, but in more complex ways that enhance efficiency in terms of medication safety. So we're in the process of developing a curriculum actually for pharmacists in terms of making sure that our people are able to utilize what is before them to make more efficient decisions and develop better utilization of medicine in terms of AI use. Yeah.
And of course, the other main issue that in this particular sector we face as a country as a whole, you witness not once, not twice or thrice, we see KMPDC ruling out some drugs within various pharmacies across the country.
Yes.
So in terms of ensuring these illicit prescriptions of drugs do not reach the consumer at the end of the day, what measures have you put in place? So
actually you have highlighted one of the most important aspects where we need pharmacists along different sectors. So where you have mentioned has to do with supply chains. So from a policy perspective, we are now speaking a lot towards having what we call not just a supply chain, but a health supply chain, because a health supply chain looks at what we call forward and backward logistics. So we look at the medicine, how is it moving from the manufacturer to the point where it gets to the patient? Yes. And then now, when it gets there, how do we get it back if there's a problem? Yeah. So when you see the Pharmacy and Poisons Board actually informing or saying we need to bring this medicine back, it means that the Pharmacy and Poisons Board or the regulators are doing a good job in terms of monitoring what is happening in the market. It means that when they notice, or when the manufacturer notices, because sometimes you may notice that something could have gone wrong when it's already in the market, that we're having good mechanisms to bring back the medicine on what we call a recall procedure. And this is done through what we call tracking. And I know the Pharmacy and Poisons Board is working really hard with, importers, distributors, and everyone along the chain to make sure that this traceability is enhanced, so that now we even know to the level where we are calling you as a patient and telling you, please bring this back because we feel that it could have had an issue. But these cases are very few, they are very rare, but it is a risk mitigation measure that must be enhanced in any country or in any security, from a security perspective in terms of medicines flowing to and from. And I think even at this point it's important to talk about having pharmacists along this chain also helps with efficiency, where we are not having too many expiries. Because what we are realizing is that, number one, patients or the public are holding so many medicines in their homes. I'm sure even for you, there's somewhere you can think. So from even a safety risk, that's a risk that you're holding or public is holding in their homes. Secondly is how do we prevent expiries along our supply chains, both from a government perspective and a private sector perspective. Private sector is doing very well because they have managed to keep their percentage values at global levels of 2%. With the government, we are working. It's working programs. We are working together to make sure that as long as they have the responsible people or the right people along their supply chain, then that problem should be reversed. So we are, I'm sure the Pharmaceutical Society of Kenya has engaged different parties to make sure that we are having a position on who should handle what aligned to global standards. Yes.
And of course, in terms of ensuring that even as the public, we can tell the difference between drugs. Let's say I've been taking Amoxil all my life, and then I notice something different. So what should be those signs we'll be looking out for in terms of the original one from the fake one?
So I think now we would now go into the counterfeit aspect. First, the first way of not accessing counterfeits is by getting your medicines from a registered and a listed pharmaceutical provider. So that means that this person has a license. So when you walk into any pharmacy today, please check that there is a license. That's number one. Then number two, and whether if you ask them, you copy license, they'll show you. They'll show you. Then secondly is to check that the person who is serving you is actually a registered healthcare provider or a pharmacist or a pharmaceutical technologist. So that awareness sort of covers you from that aspect. Outside of that chain, we are working with the government to make sure that if there are any intelligence loopholes, that we are sealing them. But I know there are processes that are going on that we cannot discuss on this forum in terms of making sure that counterfeits are not making it to the hospital or to the right chains, and that they're being dealt with at the point at which they're entering the country. Yes.
And in terms of consumption of some of these medicines, because we know the human body is different, mine cannot consume the way yours consume. So in terms of between the strong and mild medicine, so how do you go about that, especially with the various patients that you receive?
So now that now has to do with competence, and that's where now the difference is between now the pharmacist and any other provider comes in, because there is what you call the therapeutic index of medicines. So a pharmacist is trained to understand the back end of that therapeutic index aspect, and that's why it's important to know who is this who's handling, especially if you're on chronic medication, who is this who's handling this aspect. So what we are doing as pharmacists, and it's something that we have started in many hospitals especially, we are getting patients going through what you call a medication therapy management program. So which means if you have diabetes, hypertension, that maybe every once in 3 months that you're sitting with a pharmacist and they are, number one, explaining to you what this medication is doing. Number two, they are understanding which medicine is causing which side effect. And also number three, they are discussing now with your healthcare provider or your primary healthcare provider, who could be your specialist in diabetes, to make sure that whatever you're using, that we are rationalizing it and we are discussing together to make sure that this patient is getting the best out of this care. Because what we are discovering is that the numbers are going up. In terms of complexity and healthcare, the numbers are going up. We are no longer at infection rate. We are now at a stage where we are having so many patients who have diabetes, hypertension, unfortunately even cancer, renal failure, and all these different doctors that this patient is seeing are not talking to each other. So the central part becomes now the pharmacist, who is able now to rationalize all the medications for you, even tell you simple things like, take this one in the morning, take this one in the evening, don't mix these two. It's not just a matter of, you have a prescription and, you're just issuing medicines. So it is a service that is coming into this region. You will start seeing it very soon. We are encouraging our members to start doing it. There are places where they're doing it, even on the bedside in the wards. So it's something that has already started to make sure that safety aspect that we're discussing is good. But nevertheless, the Pharmacy and Poisons Board, if you're experiencing any adverse event or a side effect, so if you go to the Pharmacy and Poisons Board website, it's just say Pharmacy and Poisons Board Kenya, you can report an adverse event, a side effect or an adverse event. This data is important because it helps us know which medicines are actually working and which ones are harming our population. So it's not like you're reporting so that unashtaki mtu. Sometimes if it needs to be acted upon, like now a recall or a punitive measure, it will happen based on what happens to that medication. But now usually what that data is used for, it's used to compare between populations. How is this medicine actually working for our population in Kenya? So that's why now the pharmacist becomes a very central point in terms of healthcare.
You've just mentioned some of the health issues we're facing as a country. You've talked about diabetes, you've talked about cancer, but in terms of a disease that has overwhelmed your sector, what is it and how can it be addressed?
By the way, I would say non-communicable diseases or lifestyle-related diseases are becoming a problem in this country. It has a lot to do with our lifestyle. If you look, we are exercising less, cooking less, which I don't know why we are doing that. We are cooking less in our homes. We are eating a lot of fast food or preferring fast food as our main meals. So if you look at what even the government, aligning with what the government is trying to do, there's what they call primary health care, and preventative care is part of primary health care. So now, if you look at now where the pharmacist is coming in, number one, we are involved in that aspect of primary health care. And please know that the government signed a declaration some years back that they're going to make primary health care a priority in this country. So now with that aspect, the pharmacist is actively involved in terms of lifestyle shaping of patients. People ask us, where do you do these things? We do them on the ground within our pharmacies. And sadly, community pharmacies would say are less than 10% of the total pharmacy population. But where they are there is that service that is offered, medication therapy and also lifestyle management. Because we can see where things are heading. We are getting a lot of young people who are getting diabetes, hypertension, and cancer is becoming a big problem in this country. So these main diseases, especially the three, diabetes, hypertension, and various forms of cancer, are the problems that we're starting to see more and more within our population and in terms of managing the populations. In terms of infectious diseases, we're not doing too badly because we are discouraging the discouraging of the use of antibiotics early is helping us manage now conditions. COVID also helped our behaviors in terms of washing hands and all that. So that aspect is now being overtaken by non-communicable diseases. Of course, malaria remains a problem. HIV, AIDS, TB are still priority areas for our population in terms of managing. Yes.
And in terms of aiding the government, you know, the government wants to ensure that there is universal health coverage. So in terms of the role of pharmacists, where are you better placed in ensuring that this goal is achieved?
So when we look at the universal health coverage goals of the government, so we focus on three things. The government looks at access. So access is how accessible are pharmacists, and we are encouraging county governments that imagine we have pharmacists ready to go to even marginalized areas in this country. So just put out the job ads and you will see the difference that a pharmacist will make for your population, especially in managing the non-communicable diseases. So that is in terms of accessibility of the pharmacist and also accessibility of medicine. So we are working very hard to make sure that we have more accessible medicines in our country, and also within the government we're working with them to make sure that they have more medicines within their supply chain, that the number of medicines that they're having within the government supply chain are accessible, and there are more. Then the second part that we talk about with universal healthcare coverage is affordability. So affordability has to do with what you can see the government is trying to do with universal, you know, with payment aspects of SHA and SHE. For us, it's more of the medicines that are available in the market, available and affordable to the patient. Then the third component is quality. Quality is where right now from a policy perspective there's a quality bill that is actually going into Parliament. We have given in our comments and our position in terms of what licensing and scope. When we say scope, we say what should the different people handle when it comes to the pharmaceutical aspects. Now, in terms of service delivery and quality from a medicine perspective, where we are working, where the Pharmacy and Poisons Board is working very hard to attain what we call WHO ML3 status. So WHO ML3 is now upgrading us as a country from a regulatory perspective or a control of medicines perspective, that we are a country that is considered safe, or our controls in terms of how we manage our medicines and the challenges that you're talking about, they are being done in a way that is comparable to countries that are of a safe nature. The advantage to achieving this status, it means that the medicines that we will work very hard to manufacture locally are exportable to more competitive markets, because right now our medicines cannot be consumed by certain markets, or they are not the appeal to actually picking those medicines by those markets is not there because of that ML3 status. Yes.
And of course, the other main issue, before I ask you my second question, there's a viewer who is inquiring in terms of SHA coverage.
Yes.
When you leave the hospital and you've written that particular subscription, does SHA work in those pharmacies?
So there's what we are calling, number one, the pharmacy benefits program. So that is something that we are still working with with the Ministry of Health to make sure that, number one, the medicines that are getting into the SHA system are affordable, accessible, and they are quality within that UHC goal. Number two, right now, the government, in terms of SHA, you are only limited to a certain cost aspect that has been allocated to a certain treatment option. So if you're within that cost aspect, unfortunately, the medication that you will get will be within that cost framework, right? And that's why we're encouraging the government to have more medicines that they're stocking within their supply chain, as we're working from what they're stocking and who is managing what they're stocking, have a more efficient system within that chain, so that now patients are able now to get medicines within that channel, and they don't have to now go out and buy medicines. Because one thing that people need to remember is that the person selling the medicine buys it from somewhere, and they have to pay the person where the medicine came from. So it means that even you have to pay for this medicine so that this person can pay for that medicine. But I know our distributors are also having some challenges around, that framework, which we are actively engaging the government to make sure that the chain is open, because if you don't pay the distributor for their medication, then the distributor will not supply that medication to the center. Then it's a backward spiral of who is funding that medicine that the patient needs to receive. Yes.
Now, my other question is that these risks are associated with over-the-counter medication, particularly for older adults. What are we risking from this particular over-the-counter medication?
So currently, we have a unique setup in Kenya, and I'll keep saying this. So we have a unique setup in Kenya where all cadres practice the same way when it comes to the pharmaceutical environment. So in other countries, where you have a different personnel practicing the pharmacy, or what you call pharmacy today, they have categorized the medicines. So you categorize the medicines based on the risk profile. So you have over-the-counter, then you have what you call the pharmacy-only medicines, then you have what you call prescription medicines, and also note that pharmacists can prescribe medicines within certain limits, and then now you have the controlled medicines. In many of the countries where there are different people on the counter giving medicines, you can see that they have a list which they can stock and actually dispense. So that is a control that we are looking to also have in this country to ensure now safety of the public. Nevertheless, we are now encouraging that areas where they sell over-the-counter medicines, please have a healthcare professional, a pharmacist or a pharmaceutical technologist in that area, including our supermarkets. Because now we have sections in supermarkets that are becoming a risk factor, where we may need to start putting in a few measures to make sure that patients even can refer. They can ask somebody, how do I use this, or how many should I use? Because that picking of just any medicine from anywhere without referencing can be a problem. Yes.
And of course, given that we're coming to the end of our show, in your final remarks, I want you to talk to the young pharmacists who are out there.
Yes.
Given that you clearly stated that 5,000 of you are currently in this particular sector, 2,000 of them don't have formal employment.
Yes.
So in terms of, is there opportunity in this sector?
Let me call them because they are mine, to my young pharmacists. The Pharmaceutical Society of Kenya is very committed. They are very committed to making sure that our practice in Kenya is aligned to, number one, best practices, and number two, global standards that allow the pharmacists to actually practice in the areas. Secondly, we are working very hard to make sure that we are going to have programs that allow you to practice in the most epic manner, because there are things that we learn in school, and then now we go out there. Just like every career, you have to gain what you call hard and soft skills that allow you to operate in the environment that you are in. So we are engaging from a policy perspective all quarters, from the governors who should be employing these young pharmacists. Utilize them in your primary healthcare aspects, and you will see a difference in terms of how the public is managed within the counties and in the mashinani. But other than that is that we are not giving up. We are going to make sure that the constitutional right to the highest attainable standard of care for the Kenyan patient is achieved. Yes.
Thank you so much. That is the president of the Pharmaceutical Society of Kenya, Dr. Wairimu Mbogo. Thank you for making time for us. And of course, there you have it. I'm sure you've gotten at least useful bits, but you've been told not to just go to a pharmacy and ask for any medicine. First of all, pass through the doctor until you're prescribed. With whatever ailment that you're currently suffering from, it will be addressed at the pharmacy point. And of course, in terms of the attainance of the universal health coverage, Dr. has also talked about the role that pharmacists play in achieving this particular role from the government to achieve this particular goal of universal health coverage. That concludes our topics this morning. I need to pave way for Kurunzi Mashinani.